Yeah, the presentation focused on the targets we chose and the criteria and how relevant are the target, the mesothelin and the solid tumors across many solid tumors, and the process of developing in clinically relevant mouse models. I think that is obviously very important for translation. And then how we noticed systemic versus regional administration. And even when there's a effective administrative process, getting these cells into the tumor, how the PD-1 is getting upregulated on the CAR T cells, PD-L1 and L2 are getting upregulated on the tumor cells. That's the initial part of the presentation. And then we have published the use of checkpoint blockade in mouse models can promote the functional persistence. Based on that, we did the clinical trial, phase 1, phase 2. That's the second part of the presentation focused. And that also the PD-1 dominant negative receptor, instead of using an extrinsic agent, how we use the CAR T cell intrinsic method to promote the functional persistence. That's already in the clinical trial. That method was discussed. And the last part of the presentation, I focused on some of the hurdles we addressed before, how to promote the tumor infiltration of CAR T cells, how to counteract the inhibition by the macrophages to regulatory cells, and the stromal barrier, in addition to checkpoint blockade strategy. So that's what the presentation ended with, the next generation CAR T cells and the strategies.